Confounders, a threat to the interpretation of a research finding in endodontics by Farajollahe et al. In 2025. Confounding, it's commonly known as a confounding bias, is typically described as the blending or mixing of effects that occur when a researcher aims to assess the impact of an exposure on the outcome, but inadvertently measures the influence of another factor known as the confounding variable. Since most endodontic studies seeks to investigate the effect or association between an exposure and an outcome through the analytical observational designs, confounding is considered as the significant concern, as it obscures the true effect of the exposure. Analytical observational studies characterized into three main types: the cohort studies, the case control studies, and analytical cross-sectional studies. So the aim of this review is to clarify the concept of confounding, explaining methods for controlling these variables, and how confounding influences the interference of a causal relationship. When do variables become potential confounders, and how can they be identified? For a variable to be considered a potential confounder, it must meet three criteria. It should be a risk factor or a predictor for the outcome. It must be related to the exposure. It should not be a consequence of the exposure or a part of a causal pathway leading to the outcome. For an example, in a case control study designing evaluation the association between apical periodontitis as the exposure and cardiovascular diseases as an outcome, age is a potential confounder. In another prospective cohort study design example, examining the association between a root filling as an exposure and apical periodontitis as an outcome, the tooth type is a potential confounder. It is crucial to identify the potential confounder variables based on the exposure and the outcome of the study before its initiation and through a literature review. It is recommended to use a prior approach to identify the confounders and to determine the methods for controlling them in a study protocol. For controlling the confounders, to identify which determined variable are independently associated with the outcome, it is essential to interpret the results causally. As observed, the association may be due to the unrecognized confounder factors. For the study design strategy, there is the randomization first. In endodontic, the randomized controlled trials assessing the effect of intervention, randomization is a powerful method that can help minimize the confoundings. When a large number of study subjects are randomly assigned to the treatment groups, with each subject having an equal chance of being placed in any group, the groups are likely to be similar in terms of age, gender, and the other known confounding factors. There are also the matching. This method can be used in cohort and case control studies to create research groups that are matched based on the distribution of a confounding factors. There are two approaches of matching: the individual matching and the frequency matching. In the individual matching strategy, each subject in case groups is matched with a subject in the control groups based on a true confounding factors. With the frequency matching, the matched data analysis are not required. For restriction, the restricting the study subject within a specific category of a confounders through including and excluding criteria is a straightforward method to guarantee that all the participants have the same level of the confounders. Statistical analysis to control the confounding effect, there is the stratification. One stratifical method for controlling the confounding during the data analysis, it's called the stratification. The object of stratification is to control for the confounders by creating categories or subgroups for potential confounders, ensuring that their level does not vary within each stratum. Or you can use the multivariable models. If there are many potential confounders, the multivariable regression analysis can be used to control them, as these models are capable of managing a large number of variables simultaneously. The residual confoundings. The residual confoundings occur when a confounding variable remains inadequately adjusted despite the efforts to control for it through the study design or even the statistical analysis. Residual confounding may occur due to the presence of an additional confounding factors that were overlooked or not adjusted for, possibly because the data on these factors was not collected carefully. So, in conclusion, considering the confounding variables is an essential when studying the relationship or the effect of exposure on the outcome in endodontics, as they can alter the true effect and the relationship, potentially distorting the ability to infer the causality. If confounding is identified, controlling it through the study design or the statistical method is crucial. However, inadequate adjustment or the presence of an additional confoundings can lead to the residual confounders, which may impact the internal validity of the study itself.